A very good morning, everybody. Today we will be dealing with the anatomy of the hip joint. So, before discussing any joint in detail, we have to know we will discuss the joints under following topics. We should know first what kind of joint it is. Then we should know what are the different articulating surfaces that take part in the formation of the joint. Then we have to see what are the different ligaments that are attached to this joint. We have to see what are the factors that maintain the stability of the joint. Then we have to see the different movements that occur at the joint. And we have to see the nerve supply and the blood supply. And of course, we have to see the clinical importance. So, जब भी आप लोग कोई भी joint लिखोगे body में, हमेशा इसी part में आप लोग divide करके लिखोगे, ठीक है? So let's talk about the hip joint first. So hip joint is a kind of ball and socket type of synovial joint. Largest ball and socket joint of the body is the hip joint. Then what are the articulating surfaces that take part in the formation of this joint? So as you know, it is a joint that is formed between the hip bone and the head of the femur. So as you can see here, I've already discussed the upper end of the femur in the osteology class. So here you can see that the articulating surfaces are the head of the femur, and then we have the acetabular part of the hip bone. Now, this head of the femur, as we know, it forms more than half of a sphere. Whole of it is covered with the articular cartilage, except centrally where you have a depression that is known as the fovea capitis femoris. The fovea capitis femoris has a ligament that is attached here. Okay, so the puri surface will be covered with the articular cartilage. Talking about the other surface that takes part in the formation of the joint, we have the acetabulum. The acetabulum. When we look at this acetabulum, it has three parts. We have this surface that is known as the lunate, a horseshoe-shaped lunate surface. This is the horseshoe-shaped lunate surface. Then we have a notch here that is known as the acetabular notch. And we have the depression of floor. We can see a floor of the acetabulum. Okay. Now, the floor of the acetabulum, it is not articular, but it is filled with a fibrofatty tissue in living state. The only surface that takes part in the formation of this joint is this lunate surface, this horseshoe-shaped surface, which will be covered by the articular cartilage. So, a ball and socket type of joint. Articulating surface is the head of femur and the lunate surface of the acetabulum. This is important, okay? Now, talking about the ligaments of this joint, we will be discussing the ligaments. There are 7 ligaments that take part in formation of the hip joint. The easy way to remember is that हर एक जॉइंट का अपना एक कैप्सुलर लिगामेंट तो होता ही होता है, जो आप लोगों ने नॉर्मली डिस्कस किया है जब आप लोगों ने जनरल एनाटॉमी ऑफ जॉइंट्स पढ़ा, राइट? सो कैप्सुलर लिगामेंट or the joint capsule will be there. Then, because this is a joint that is taking part, that is formed by the femur and the hip bone, and you know that there are 3 parts of the hip bone. We have the ilium, we have the ischium, and the pubis. So we will remember one ligament from each of these parts. So we'll have the capsular ligament, then we'll have the iliofemoral, the pubofemoral, and the ischiofemoral. Okay. Then we have a transverse acetabular ligament. We have the acetabular labrum, and we have the round ligament of the head of femur. Okay. So 7 ligaments you have to remember: capsular ligament, iliofemoral, ischiofemoral, pubofemoral ligament, transverse acetabular ligament, acetabular labrum, and round ligament of head of femur. Okay, let's talk about the capsular ligament first. The capsular ligament, or the fibrous capsule of the hip joint, it is strong and dense sac that encloses the entire hip joint. It is a sac here that is enclosing this hip joint. Whenever we discuss the capsular ligament or the fibrous capsule of any joint, we talk about the attachment of the capsule at the different bones taking part in the formation of the joint, right? So the On the hip bone, if we see, it is attached about 5 to 6 millimeter beyond the acetabular margin. यहाँ पे कहीं acetabular margin है, वो तुम्हारा 5 to 6 millimeters beyond the acetabular margin. It is attached here. Then it is attached at the outer aspect of the acetabular labrum and the transverse acetabular ligament, right? So as you can see here, this is a diagram showing the hip joint that has been opened, right? This you can see here, this white, this is the capsule. So I said that hip joint पे अगर हम देखेंगे 4 to 5 millimeters beyond the acetabular margin, it is attached here. Then this is a labrum which is attached to the margin of the acetabulum. So it is attached on the outer surface of this acetabular labrum as well. And inferiorly, we know that the lunate surface, we have a cut बिकॉज ये हॉर्शू शेप होता है, तो यहाँ पे एक लिगामेंट आ जाता है जिसको ट्रांसवर्स एसिटाबुलर लिगामेंट कहते हैं. सो ये आउटर सरफेस ऑफ ट्रांसवर्स एसिटाबुलर लिगामेंट पे भी लगती है. ओके, तो दोबारा कैप्सूल 5 to 6 millimeter बियॉन्ड द एसिटाबुलर मार्जिन लगती है, आउटर सरफेस ऑफ लैब्रम पे लगती है, आउटर सरफेस ऑफ ट्रांसवर्स एसिटाबुलर लिगामेंट पे लगती है. ओके, फिर when I discussed the upper end of the femur, I said that interiorly we have an intertrochanteric line and the capsule is attached on the whole of this intertrochanteric line. So I said that anterior surface of the neck of femur was, whole of it was intracapsular. Whereas posteriorly, when we see, it is not attached to the intratrochanteric crest, but it is attached 1.3 centimeters before or superior to the intertrochanteric crest. Therefore, only half the portion of the neck was intracapsular, posterior. So this is a diagram that is showing the same thing. This is the intertrochanteric crest, and we can see it is not attached to the intertrochanteric crest here, but is it attached 1.3 millimeter beyond it. So ये 3 points आपको लिखने हैं, ठीक है. Margin कहाँ पे capsule का attached होगा? Capsule का acetabulum के बाहर वाली surface पे 5 to 6 millimeter beyond acetabular labrum पे, transverse acetabular ligament पे, neck पे, anteriorly intertrochanteric line पे, posteriorly intertrochanteric crest से पहले लगेगा, ठीक है. Now, when we see this ligament, दूसरी important चीज जो उसमें आप याद रखोगे is that the capsule is thickest anterosuperiorly. इस पोर्शन पे ये थिक होता है और स्ट्रॉन्ग होता है, whereas posterior inferiorly जो कैप्सूल होता है वो वीक होता है. एक चीज और, उसके अलावा जब हम कैप्सूल को देखते हैं तो कैप्सूल में दो तरह के फाइबर्स देखे जाते हैं, इनर फाइबर्स और आउटर फाइबर्स. इनर फाइबर्स जो होते हैं दे आर circularly arranged around the neck of the femur and they form the zona orbicularis, जिसकी वजह से there is an hourglass constriction around the neck of femur. Whereas if we see here, some of the fibers from the intertrochanteric line, they pass deep to the synovial membrane, and these fibers are known as the retinicular fibers. Okay, so दो तरह के fibers होते हैं, उसकी diagram मेरे पास नहीं है, तो to remember it आप दो तरह के fibers remember करेंगे. नीचे पहले एक fibers होंगे जो circularly arranged होंगे, that are known as the zona orbicularis, और बाहर से fibers जो आएंगे intertrochanteric line से, that are known as the retinicular fibers, जिसके through retinicular vessels pass. You can see the joint capsule there, the labrum, the transverse acetabular ligament, and okay. Now, another thing that you will have seen in the general anatomy of the joint, that synovial joint is lined in the inner surface by a synovial membrane. So capsular ligament के बाद दूसरी important चीज है, what is the synovial membrane and how is it attached to the different parts. So this is a transverse section through the, this is a section through the hip joint. You can see here, this is the acetabulum. This is the acetabulum, okay. This portion is the acetabular labrum, just like margin पे attached होगा, right. This is the ligament of head of femur. यहाँ पे we have the transverse acetabular ligament. Okay. Now this portion, the whole of this reflection is the synovial membrane. So when we see the synovial membrane, It covers the inner surface of whole of this fibrous capsule. Here and here you can see it lines the inner surface of the capsule. It lines both the surfaces of the acetabular labrum. It lines the inner intracapsular part of the neck of the femur, as you can see here, but it ceases at the periphery of the articular cartilage. आर्टिकुलर कार्टिलेज पे कभी भी साइनोवियल मेम्ब्रेन नहीं लगती. ओके, उसके बाद लिगामेंटम टीरीज जो है उसको इन्वेस्ट करती है यहाँ पे, ठीक. देन एट द ट्रांसवर्स एसिटाबुलर लिगामेंट साइनोवियल मेम्ब्रेन डाइवर्ज करती है दो पार्ट्स में. एक पार्ट जाता है और कवर करता है एसिटाबुलर फैट को, और रेस्ट ऑफ द पार्ट जाता है और कवर करता है हमारे inferior layer of the fibrous capsule. Okay, Dubara. So this is the interior of the joint. As you can see here, this is the acetabulum, this is the acetabular labrum. Okay, this is the head of femur that is covered by the fibrous capsule. This is the capsule, articular cartilage. This is the fibrous capsule here. This is the ligament of head of femur, and this is the transverse acetabular ligament. So this is the synovial membrane. When we trace the synovial membrane, it lines the inner surface of this capsule. It lines both the surfaces of the acetabulum, labrum. Then it lines the intracapsular part of the neck of femur. It ceases at the periphery of the articular cartilage. Then it covers this transverse ligament of the head of femur. Then at the lower part of the transverse acetabular ligament, it is divided into two parts. One of the part continues and covers the inferior surface of the capsule, whereas another part goes and covers this acetabular fat. Okay, I hope it is clear. This is a diagram that has been taken from your BD Chorasiya, and it's showing the same thing. So you can see here the head of femur, the acetabular labrum, the fat of the acetabular fossa. This is the ligament of head of femur. This is the transverse acetabular ligament. Whole of this is the capsule. Dotted जो बनाए हुए आपका synovial membrane. ठीक है, यहाँ पे इसने दिखाए हैं फाइबर जो ना ऑर्बिकुलरिस के, और ये रेटिनिकुलर फाइबर्स हैं जो वेसल्स देके जाएंगे. Now, talking about the ligaments here. Okay, so first ligament that we'll be discussing here will be the iliofemoral ligament. The iliofemoral ligament, it is the strongest ligament of the hip joint. When we look at it, it is inverted V-shaped ligament. This one, inverted V-shaped with its apex up, that is present superiorly, whereas its base is present inferiorly. The apex is attached to the antero-inferior iliac spine and the part below it, whereas the base is attached to the intertrochanteric line. When we look at the ligament, it has three parts: a medial band of vertical fibers, a lateral band of oblique fibers, and an intermediate area of these fibers. Okay, the medial band of vertical fibers is attached to the inferior part of the intertrochanteric line, whereas the oblique fibers are attached to the upper part of the intertrochanteric line, and the rest of the intertrochanteric line is covered by the intermediate fibers here. So you should know the attachment of this iliofemoral ligament. This one. Then talking about another ligament, that is the pubofemoral ligament. The pubofemoral ligament is a triangular ligament. Its apex is present below, whereas its base is present superiorly. The base is present, where is it attached to? It is attached to the iliopubic eminence, the superior ramus of the pubis, and the obturator crest. Here you can see this. This is the base. Okay, so it is attached to the iliopubic eminence, superior ramus of the pubis, part of the superior ramus of the pubis, and the obturator crest. Inferiorly, it blends with the antero-inferior part of the medial band of this iliofemoral ligament के साथ ये blend करता है. ठीक है, so यहाँ पे याद रखने के लिए दो ligaments अभी देखिए, iliofemoral और pubofemoral. Iliofemoral सबसे strongest है, इन्वर्टेड वी शेप्ड है, एपेक्स जो है ऊपर है इंटेरो इंफीरियर iliac स्पाइन पे, बेस जो है वो नीचे जाके तीन बैंड्स में डिवाइड करती है। मीडियल बैंड नीचे जाता है और इंफीरियर पार्ट पे लगता है ऑफ द इंटरट्रोकेंट्रिक लाइन, ऊपर वाला अपर पार्ट पे लगता है ओब्लिक बैंड और इंटरमीडिएट फाइबर्स, ठीक है। और प्यूबोफेमोरल जो है वो आता है और अब आपका लगता है इसकी एपेक्स नीचे है, बेस इसका ऊपर, ठीक है। इसके बाद so this is another diagram. This is showing your iliofemoral ligament and this is your pubofemoral ligament. Okay. Then we have another ligament that is known as the ischiofemoral ligament. The ischiofemoral ligament, this ligament that is present posteriorly, the ischiofemoral ligament is relatively weak and it supports the capsule posteriorly. Above it is attached to the ischium hair, posterior inferior to the acetabulum. From the ischium, its fibers spiral around the neck of femur to be attached to the greater trochanter of the femur. This one. Okay. Now, then we have the round ligament of head of femur. The round ligament, this is the hip bone. This is the lunate surface. This is the ligamentum teres femoris. So it is flat triangular ligament with its apex that is attached to the head of femur, whereas its base is attached to the transverse acetabular ligament. It is ensheathed by the synovial reflection, the conical reflection of the synovial vein. It does not increase the stability of the joint, but it only transmits vessels to the head of femur, which are the acetabular branches of the obturator and the medial circumflex femoral vessels. So basically, stability में इसका कोई काम है नहीं, ये एपेक्स इसका लगता है हेड ऑफ फीमर पे, whereas बेस जो उसकी है वो ट्रांसवर्स एसिटाबुलर लिगामेंट पे लगता है। और जैसे मैंने कहा आपको कि साइनोवियल मेम्ब्रेन बोथ द सर्फेसेस ऑफ एसिटाबुलर लैब्रम जो है उसको कवर करता है बाहर से अंदर से, तो यहाँ आके वो इस पे रिफ्लेक्ट हो जाता है, ठीक है। Then we have the acetabular labrum. जैसे कि we have seen in the glenoid labrum, the same way acetabular labrum is a fibrocartilaginous rim that is attached to the margin of the acetabulum. What does it do? It deepens the socket, it deepens the acetabulum and grasps the head of femur in place. Then we have this ligament. This is the transverse acetabular ligament. The transverse acetabular ligament bridges the acetabular notch. There is a notch here, right? So it bridges the transverse, it bridges the acetabular notch. However, it is devoid of any cartilage. So you can see here, it converts this acetabular notch into acetabular foramen through which nerves and vessels pass. So these were the 7 different ligaments of the hip joint. What were these? These were the first we have the capsule, then we had the iliofemoral, we had the pubofemoral ligament, then we had this ischiofemoral ligament, then we had the acetabular labrum, the round ligament of head of femur, and the transverse acetabular ligament. This finishes the different ligaments you see. Now, talking about the stability of the hip joint. The stability of the hip joint, there are certain factors that play an important role in the stability of the hip joint. These are, first of all, the acetabular labrum. We know acetabular labrum deepens the cavity of the acetabulum. Acetabulum as compared to the glenoid cavity ऐसे ही deep होता है acetabulum. उसको और deepen करने के लिए acetabular labrum present होता है. First, acetabular labrum. Second, we have 3 important ligaments: the iliofemoral, pubofemoral, and the ischiofemoral ligament. And these ligaments strengthen the capsule of the joint. Then the surrounding muscles around the hip joint, especially the glutei, they're very strong muscles. They also play an important role in maintaining the stability of the joint and the length and obliquity of the neck of femur. We know that the femur is placed oblique in the body, and there is an angle between the neck and the shaft. these factors play an important role in maintaining the stability of the hip joint. Okay, now there is another thing that I want to discuss here that is not related to the joint but related to the femur as such. So we have three angles we see in the femur. First, we have the neck shaft angle, which I've discussed in my osteology class. This is a line passing through the long axis of the femur, and this is a line passing through the neck, head and the neck. So here we have an angle between the long axis of these two. This is known as a neck shaft angle, which is about 120 to 135 degrees. Then we have another angle that is known as angle of torsion. What is the angle of torsion? This is a diagram. ये understand this. हम क्या देखते हैं? These are the condyles. If you look at the femur from below through the condyles, if you look at the femur, so this part is the condyles, and this part, if you see, this will be the axis of the neck and the head. Okay, so if we draw a line passing through the condyles and we draw a line through the neck and the head, the angle between the two is known as angle of torsion. So this is the axis of the femoral condyles, and this is the axis of head and neck. And there is an angle between them that is known as the angle of torsion. Look at this diagram. ये inferior view था through the condyles. ये इसी चीज को समझाने के लिए सुपीरियर व्यू है, ठीक है. एसिटाब्यूलम है, ये फीमर का हेड है, ये नेक है, और ये आपके कॉन्डाइल्स, ठीक है. जब आप ऊपर से देखोगे तो कॉन्डाइल से जो एक्सिस पास होता है और नेक शाफ्ट से जो एक्सिस पास होता है, दे मेक एन एंगल दैट इज नोन एज एंगल ऑफ टॉर्जन दैट इज 7 to 12 degrees. Then we have another angle that is known as angle of obliquity. What is this? ये आपके वाइवा में फीमर में पूछा जाता है. Angle of obliquity, side determination. When we saw the side determination of femur, I told you that the femur is not placed vertically in the body, but it is placed obliquely in the body. So there is an angle. What is the angle? The angle angle formed between the long axis of the femur. If we draw a line through the long axis of femur, and we draw a perpendicular line, this perpendicular line, where through a line passing through the femoral condyles. So this is a line passing through femoral condyles. यहाँ से अगर perpendicular line लेते हैं और long axis of femur के बीच में अगर लेते हैं, उसके बीच में angle of obliquity आते हैं, ठीक है. So तीन angles आपको पता होने चाहिए. एक neck shaft angle होता है, एक angle of torsion होता है, और एक आपका angle of obliquity. Okay. So this finishes today's lecture. I hope it is clear. If anybody has any doubt, they can contact me.